The next 5 questions are also from people on the spectrum, but they're all about diagnosis. I'm a Canadian woman, and I suspect I have Asperger's. When I went to a clinic for a referral, the doctor did not take me seriously and dictated that I don't have AS and would not give me a referral to a psychologist. My question is, as a Canadian female, what is the best way I can go about getting a referral so I can finally know if I'm Aspie or not? This is from the Beatles fan, 420.
Well, first of all, congratulations on being a Beatles fan. I think you've got very good taste in music. Now, that's irrelevant. Canadian woman. Well, one of the major problems is being a woman. Most diagnosticians are not familiar with how the pattern of abilities in Asperger syndrome is different in the female expression, and how women are usually more constructive and intelligent in the way they camouflage their social confusion. Now, fortunately, if you're in Canada, I would recommend a colleague and friend of mine, Dr. Isabelle Henault, Henault. She's French-Canadian in Montreal. She has worked with me over a number of years at my clinic here in Brisbane. She was my locum when I was writing my book. She was the one person I trusted for my families. And she came out from Montreal to Brisbane. She's been here for several years. She's now returned to Montreal, and she's the person I would recommend because she does know the area.
The next question is about, when I first read about AS years ago, I immediately thought of my friend. He didn't want to hear about it then. Many years later, I found out about myself, a family member, and some other acquaintances. All are on the spectrum. But my friend refuses to even look at the materials and insists, I don't have your disease, despite how many people behind his back might say that he's a poster person for AS. I want to help connect him with the local AS resources that have helped me, but he would have to be motivated on his own, as I cannot change his mind for him. It is really frustrating, though, to hear him go on about issues that I know that there's help for if he would even think of screening himself. Do you have any advice? And this is actually a composite question from 2 people at Autism Hangout, Sleepy and Rockpool. First off, note their empathy.
Okay, yes, indeed. I like the quote, I don't have your disease, and I think this gives me an enormous amount of information. So it may well be that that person considers that in some ways it's a mental disturbance, maybe a schizophrenia example, or that it may be somebody who is defective. In other words, they've got a very bad perception of what it is, and they don't want to have it. Now, it may well be that over time, this person has actually known that they were different from other people, probably from when they were very young. And a quite understandable way of compensating for that is to see yourself as perfectly normal and perfectly okay, which is said more to convince yourself than other people. It's comforting to have that sort of thought that other people have their issues, but I'm all right. No, as such, he's not going to accept anybody challenging the structure that has given him comfort and support all through those decades. So I ask the person to be patient. But there may come a time in their future when they need a reason for help, maybe in terms of underachieving in terms of their career. It may be in relationships that they're seeking the relationships, or relationships may unfortunately collapse. And the issue here is going to be self-understanding rather than denying the characteristics you've got. So I think at this stage, just be patient.
Okay. The next question. Hi, Professor Atwood. I'm undiagnosed. I had experience with bad doctors before, and I fear being misdiagnosed. I'd like to be diagnosed someday by someone I trust, like you. How do self-diagnosed Aspies with no doctors or Aspie friends get support and references when they get into trouble with officials?
The difficulty is that sometimes the diagnostic professions can be incredibly conservative and may not recognize the characteristics, especially in someone at the upper ranges of ability. And their concept of autism spectrum disorders is someone who's quite significantly disabled, and you don't fit their schema of the type of person that they have known previously. I do recommend trying to find someone who's had experience of at least 100 adults with Asperger syndrome to understand the variations in adaptation, etc. Now, if there's getting into trouble with officials, it's not, I don't know quite what the problem is there, but it does mean that there needs to be that degree of understanding, and the diagnosis needs to be confirmed. That's all I can hope is that they will find someone who does know. If not, you're going to have to travel. And it may be worth traveling to a centre of excellence, at least to get that official paper.
Next question again about diagnosis. The doctor who wouldn't diagnose me said he couldn't determine whether I'm a person with Asperger's who copes very well, or a neurotypical, one who's acquired some autistic traits. I will succeed in some social situations 8 out of 10 times, but each and every time I do, nobody is more surprised than me. I have to work it up from scratch every time, and there's always the split second in which I wonder, will it work? And I can never be sure if it will work the next time. I used to get so mad at myself for not learning how to communicate with others, but I thought after the 6th or 7th or even 17th time, I ought to know how it works. But I don't. It still feels like I've never done it before. Is this common in people on the spectrum? I tend to think that my brain is like a bathtub with no stopper, social skills-wise anyway. Everything I put in runs out the other end, leaving some puddles, though the puddles make me hopeful. This is from Angie at Autism Hangout.
Well, I do have compassion for you, Angie. In a way, becoming neurotypical or understanding social rules, what people are thinking, etc., is like learning a foreign language. And when you learn a foreign language, you learn that there are always exceptions. People who learn English as a second language always complain of the exceptions, and it is a language that's been combined by many different influences from Latin to French and Anglo-Saxon, that the exceptions leave you quite bewildered, and that's what happens with social interactions. Is they keep changing the rules, and you found the rule and you've got it right, but now it's a new rule. But the problem here that I mentioned, it's not just social, it's also personality, and that's a whole new ballgame. The personality of that individual is different. You know that at school. At high school, you had teachers who were ostensibly teaching you that subject, but you may have known that their personalities were very different in what you could say, what you could do, etc. So it's also understanding the concept of personality, and that's why with Asperger syndrome, I'm very keen on teaching such individuals how personality affects what you do and how to adjust what you're doing to the personality of the person, which means that it's very much a work in progress. Certain things are remaining, and she's worked out what to do, but sometimes it seems like a whole new ball game, and I'm now in a situation I have no previous experience of what to do. So all I can say is to encourage you to keep going. The problem isn't you, it's the fickle, inconsistent, emotional, personality-driven neurotypicals that are weird and inconsistent.
Okay, next question. Dear Dr. Atwood, my daughter is now 7 years old and has social problems since kindergarten. We have decided to have a go and diagnosis for her. I was diagnosed with Asperger's last year, and she shows a lot of signs of autism as well. The psychologist said she very clearly shows autism as well as ADHD, but she can't diagnose her because her autism might be learned from me. The thought that I might have taught her not to be able to read others' emotions and social signs dismays me. How probable is it that her behavior is learned? Am I at fault? And this is from Aspel at Autism Hangout.
Okay. Again, another good question. As a clinician, what I'd be looking at is how your daughter interacts with their peer group, with her peer group, away from you. You see, she may have learned to adapt to your particular style. And the way I describe it is that you may have an Aspie household because you're the mum there, and in which case she may learn the conventions and rules of that Aspie household and what you need to do to survive. But that may not be her real or natural self. And with her peer group, in the playground, in the classroom, she may show the neurotypical pattern. So at the age of 7, I doubt that it's imitation. It's more likely to be the genuine article. And so I really would ask that psychologist to observe your daughter in the school setting, which will be the real test of those characteristics.
Very good.